What is the most common presenting age of Ewings sarcoma? Classically, Ewings sarcoma is a condition seen in the first and second decade, with the peak during the second decade is what you need to remember. Now, what is the speciality of Ewings sarcoma? It's a diaphyseal tumor. It is there along the shaft of the bone. So, there are only few tumors which are diaphyseal in their location, which is frequently asked in exam. You can remember A. lemon, some stupid way of remembering. Adenoadenoma, lymphoma, Ewings sarcoma, multiple myeloma, osteoid osteoma, neuroblastoma. Don't remember all also. Only two things you remember in this. Osteoid osteoma and Ewings sarcoma are the two classical diaphyseal tumors is what you have to basically remember. Ewings sarcoma belongs to a big club. Nowadays, for everything there is a club membership, no? You are a member of Indian Association of Pediatrics, Indian Medical Association, like that. It belongs to a big club called round cell tumors. What are all the tumors which are called round cell tumors? Is a favorite question of the examiner. Reticulum cell sarcoma, osteogenic sarcoma, metastatic neuroblastoma and Ewings sarcoma, they are all basically Rome, are the classical round cell. If you do histology, you find classical round cells in the histology. That's the reason these four are called round cell sarcomas. Then how will you remember osteoid osteoma? Ewing sarcoma is diaphyseal, Ewing is diaphyseal, osteosarcoma is metaphyseal. E is closer to D, O is closer to M. I, J, K, L, M, N, O, P, Q, R, S, alphabets, no? So that's a easy way. Then another favorite question of the examiner is, what are radio-resistant, radio-sensitive, chemo-resistant, chemo-sensitive tumors? This list is something that you have to be very sure. Orthopaedics, few lists are there. Melanoma, osteosarcoma, pancreatic carcinoma. Wherever you go. Remember, this is a favorite question, frequently asked in JIPMER, AIIMS and DNB and all exams. Melanoma, osteogenic sarcoma, pancreatic carcinoma, they are called the radio-resistant tumors, is what you have to remember. How will you remember? Melanoma is skin cancer. We all know because of radiation we get skin cancer. If radiation causes skin cancer, how can radiation cure the skin cancer? So, melanoma, radio-resistant, Nicolo. Then, osteogenic sarcoma. Whenever they say bone tumor means, as a undergraduate student, do we remember Ewing sarcoma or osteosarcoma? Osteosarcoma is something that we remember more. So, classical bone tumor, but resistant, radio-resistant. And pancreas is somewhere retroperitoneal. So, radiation cannot reach. Some stupid way to remember, but three classic. But there are some tumors classically radiosensitive, very radiosensitive. Seminoma is sensitive. Ewing sarcoma, Wilms tumor, lymphoma, multiple myeloma, medulloblastoma, these are all considered to be the radio-resistant, radio-sensitive tumors is what you have to basically remember. I am very happy to see around 29 online viewers, but only 7 or 8 offline classes. I am only afraid that offline classes become extinct over a period of time. Probably the next generation students will say, oh, people used to come to class. Oh, you used to have class? Yeah. But without your coming, how can a teacher can get a drive to teach? So, thanks for coming today morning. And we have Bharat, Sharma, Anu and many more. What are chemo-resistant? Gastric carcinoma, bladder, soft tissue carcinoma and squamous cell carcinoma, they are all chemo-resistant. And anyway we know, anywhere squamous cell carcinoma, radiation is the best treatment. Melanoma is radio-resistant, but squamous cell carcinoma is radio-sensitive. That's the point. Then Wilms lymphoma, teratoma, ANL in children, choriocarcinoma, they are all chemosensitive. So this is a small list that you need to. Now 5-6 points about Ewing sarcoma. It is called P10 tumor. What is P10? Peripheral primitive neuroectodermal tumors are a class apart. P10, undifferentiated P10 tumor. And where does it arise? Typically on the thigh bone, femur. Diaphysially it will originate, and one very peculiar thing about histopathology. This slide is going to come in the tomorrow's exam in DNB. Ewing sarcoma PAS, if you do PAS staining, it is strikingly stained. So that is very, very classical of Ewing sarcoma. So PAS positive, diastase digestible, glycogen and reticulin containing cells are the classical feature of the Ewing sarcoma is what you need to remember. And what is the translocation? 1122 is classically Ewing sarcoma is it is diaphysial. Diaphysial is like a femur shaft. Shaft is like 1. 2 ones, double them, 22. 1122. So this is the classical appearance of the Ewings, where you have the there are two things. Onion skin peeling kind of an appearance is periosteal reaction, but if you look into the tumor, it is typically will show diffused calcified shell-lock kind of a thing. So X-ray reveals this laminated periosteal newborn formation, which is onion shell peel appearance, is what you need to remember. So looking at the periosteal reaction, can you be able to tell whether it is benign or malignant? Yes. If it is a solid periosteal reaction like this, generally it is benign. Whereas lamellated, like what you see in case of Ewing sarcoma, is aggressive. Then sun ray like appearance as what you can see in case of osteogenic sarcoma is very aggressive. And if it is able to lift the periosteum and form a Codman's triangle, then that is considered to be very, very aggressive. So that's how you basically classify. Now what is a biphasic tumor is a very important question about the bone tumors. Synovial sarcoma is called biphasic. What is the meaning of biphasic? You have a monophasic and you have a biphasic. Biphasic means you are having both two germ layers, derivatives will be there. So what you can see is epithelial component E. Epithelial component is there, S is synovial component is there. Such two components being there is called as biphasic, which is the nature of synovial sarcoma is what you need to basically remember. So where does synovial sarcoma occur? It occurs in the knee and the thigh. Dual lines of differentiation, classical. You find calcified concretions inside it, and it also has got a chromosomal translocation between X and 18 between the two. And what is the treatment? It needs to be treated aggressively. So that's the reason limb sparing therapy along with chemotherapy, it is chemosensitive, can very much be used in the management of synovial sarcoma. The next question is once more on synovial sarcoma. So examiner has some uncanny look on synovial sarcoma, but these are the 3-4 points that you need to remember about it. Okay, so it is a misnomer actually. It doesn't arise from synovium. It actually arises from the bursa around the joint, not from the synovium. But still it is called synovial sarcoma because initially they confused that it is synovial sarcoma is what you have to basically remember. So tendons, tendon sheaths and bursal structures, usually beyond the confines of the joint capsule but not from synovium, right, is what you have to basically remember. Now if you take a radiograph What is very classically synovial sarcoma presents like a soft tissue mass with an extensive calcification. It is not arising from the synovium but from the surrounding structures is what you need to remember. So which isotope is used for the bone tumor scanning, doctor? We use strontium 89. The main reason is it remains in the tumor for up to 100 days, and nowadays radium 223 is also used in addition to strontium in order to investigate the bone tumors. Now comes the most commonology of orthopedics. There are some 7-8 most commons. If you didn't know that, you are not the most common guy to be in the top 100 ranks. Be very sure. So what is most common malignancy of the bone? It gets secondaries are the most common if they say only malignancy. But what is most common primary malignancy of the bone? Then becomes multiple myeloma is the answer. Most common benign tumor of the bone, it is osteochondroma. Easy to remember. Bone means bone, joints, musculoskeletal system. Some tumors are chondro, some tumors are osteo, but osteochondroma is dual degree, right? DNB, it is like, so it is most common, osteochondroma. Then in children and adolescents, what is the most common malignancy of the bone? Because multiple myeloma occur in adults, not in children. So osteogenic sarcoma is most common in children and adolescents. But overall, if they ask what is the most common primary malignancy of the bone, multiple myeloma. थोड़ा अंग्रेजी की बात जरा ध्यान से देखना पड़ता अंग्रेजी को. Then what is the most common benign bone tumor? It is the osteoid osteoma, which is called the most common benign tumor, because osteoid osteoma is saying osteo 2 times, because it is most common is what you have to basically remember. Then what is the primary malignant bone tumor in the age group of 40 to 60 years? 40 to 60 years. It is chondrosarcoma. If the question is asked, see, elderly people, I mean overall multiple myeloma, but multiple myeloma generally occur after 60. Children it is, in children and adolescents osteosarcoma. Whereas in case of 40 to 60 years, if the question is asked what is most common, that becomes chondrosarcoma. And what is the most common tumor of the hand bones? Hand bones will be enchondroma is what you have to ultimately remember. So don't, you will remember me in exam hall while answering the most common question. Now what is the commonest malignant bone tumor? You see, such a frequently asked question. 2001, 2011, 2013, from the time of Ikshvakus, Kakatiyas, they have been asking the same question, right? So multiple myeloma, most common primary malignant bone tumor. Then bone tumor arising from epiphysis. Doctor, epiphyseal, diaphyseal, metaphyseal. If you are not ready with the list in your pocket, you are not a prepared aspirant for DNB. Take it as my, not only for DNB, any entrance. Which way you remember is your choice. But you must be ready and wait for one question in the exam hall when you walk in. So now you know now, after attending, you attended pathology and all these subjects, medicine and now you are anticipatory. You are like that National Geography channel lion waiting for a grazing deer to ready and jump and catch it and then kill it and say, yeah, I did it in DNB. That is what I am looking for. Not the one who is afraid that, oh God, did they ask bone tumor? I forgot. I postponed to do it after my engagement is over. So don't do that. Right? So, which are the tumors from the epiphysis? Chondroblastoma. is from the epiphysis. Why suddenly this female officer? There is one way of remembering. You remember female officer in order to remember epiphyseal tumors. There is no relation between the two. It is like getting a burning sensation and later getting seizures. That is all about mnemonics. It's like that. Suddenly, oh, burning sensation. Then the patient goes into seizures later on. So, like that, but female officer. Okay, what is female officer about? It is a mnemonic for diaphyseal tumors. Yeah, female officer stands straight like a shaft of the bone, no? So, remember diaphyseal tumors. Some stupid way to remember. So, what are female? Fibrous dysplasia, eosinophilic granuloma, metastasis. Metastasis also go to diaphysis. Adenoadenoma, leukemia, lymphoma, Ewings sarcoma, and osteoid osteoma. Officer is osteoid osteoma. So these are all basically what? Diaphyseal tumors is what you need to remember. So where does fibrous dysplasia occur, doctor? Diaphysis. Then what are the tumors which are metaphyseal? Non-ossifying fibroma, chondromyxoid fibroma, solitary bone cyst, osteochondroma, Brody's abscess, osteogenic sarcoma, chondrosarcoma, they are all basically what? Metaphyseal. Already we said osteo, O is closer to the letter M. So you remember osteogenic sarcoma is metaphyseal. If bone is osteogenic, what is cartilaginous? Chondrosarcoma. If bone is osteogenic sarcoma, what is cartilage? Chondrosarcoma. Even chondrosarcoma is also metaphyseal. And what is bone plus cartilage? Osteochondroma. Even that is also metaphyseal. Then chondromyxoid fibroma is one more thing you need to remember, which is metaphyseal. But they don't ask, doctor, chondromyxoid fibroma, non-ossifying fibroma, Brody's abscess, they don't ask. What are they going to ask? Which are metaphyseal means? Entrance exam is not about entire textbook. It is selective part of textbook. Right? At least for exam sake, you remember osteogenic sarcoma, chondrosarcoma, osteochondroma, solitary bone cyst. Like a parrot, you must vomit it out anytime you are woken up from the sleep. Then epiphyseal lesion is what? Epiphyseal lesion is chondroblastoma. Once more, it depends upon before the closure of the growth plate and after. So prior to the closure of the growth plate, chondroblastoma is typically epiphyseal in location. And giant cell tumor. You can remember epiphyseal closure will cause dwarfism. Epiphyseal non-closure will cause giant. So giant cell tumor comes and sits in the epiphysis and makes the person to become giant because, no, that is not the reason. I mean, some way to remember, some stupid way to remember. So giant cell tumor, it originates in metaphysis, but it is also metaphyso-epiphyseal in its location. Then clear cell chondrosarcoma, fibrous dysplasia. Fibrous dysplasia can occur in multiple locations. So are all epiphyseal. One way to remember is Kagi. Where will that female officer will put us in? Prison. So cage, Kagi. So chondroblastoma, aneurismal bone cyst, giant cell tumor, infection and eosinophilic granuloma. They are all basically what? Epiphyseal is what you have to basically remember. Then what are bone forming tumors? What are the bone tumors which involve the soft tissue? So these are the two more nagging lists that you need to remember. Okay. So osteoma, osteoid osteoma, osteoblastoma, ossifying fibroma. These are all classically called bone forming bone tumors. They form the bone, right? Then which will have soft tissue involvement? Soft tissue is like a chocolate fudge. So my mother eats chocolate fudge often is one stupid mnemonic if are in USMLE circles. We don't think USMLE is all logical exam. There is also mugging part for USMLE, Canadian licensing exam, MRCP, MRCS, anywhere in the world some mugging part is inevitable. That is called medicine. So metastasis, myeloma, Ewings sarcoma, chondrosarcoma, fibrosarcoma, osteosarcoma, they all will have some soft tissue invasion is what you have to basically remember. So where do you see onion peel periosteal reaction, doctor? Sing along the answer. Typically in case of Ewings sarcoma. One more list is coming up quickly. What are osteoblastic, what are osteolytic, what are mixed? Don't remember mixed? It's a waste of time. You remember osteoblastic and assume everything else is osteolytic or mixed. Right? So what are osteoblastic? Purely osteoblastic means only prostate, breast, Hodgkin's lymphoma, carcinoid, medulloblastoma. Only their secondaries are considered to be osteoblastic secondaries. Okay, doc. Prostate, breast cancer, Hodgkin's lymphoma, carcinoid and medulloblastoma is what you have to basically remember. What is an epiphyseal tumor out of all this? Come on, now you shoot after what all we learned. Giant cell tumor. Bone tumor arising from epiphysis. Very recently also 2014. Classically chondroblastoma is what you have to basically remember. Then which of the following arise from the diaphyseal medullary canal? Female officer, Ewings sarcoma. Which is contained within the bone? Which metastasis is contained within the bone out of all this? Actually, what is the meaning of contained within the bone? Osteoblastic. So, prostate. Actually, breast also is osteoblastic as much as lymphoma. Anyway, prostate is being given, that is the king of all osteoblastic secondaries. Then one special thing about renal tumor, what is it? By the time the local symptoms of renal cell carcinoma arise, already metastasis will occur. So that is unfortunate thing about renal cell carcinoma. At the time renal cell carcinoma declares itself as hematuria, varicocele which is suddenly developing. There are so many telltale features of renal cell carcinoma. By the time you discover it only, it is already metastasized to the bone is what you have to basically remember. What conditions lead to oncogenic rickets? Okay, what is the meaning of oncogenic rickets? Can you give me the board? Basically, if you look at the kidney, what is the effect of parathormone, doctor, on the kidney? Parathormone. Parathormone will lead to the retention of calcium and loss of phosphate into urine, and will have a phosphaturic effect. Now some tumors typically will cause one of the receptors to show an increased activity which lead to phosphaturia, just like as the parathyroid is acting, and that lead to significant amount of phosphaturia leading to clinical rickets. It is a paraneoplastic presentation of some tumors. So which tumors will show such a phosphaturic effect and lead to development of the oncogenic rickets is a very important question of the examiner. Osteogenic sarcoma, non-ossifying fibroma, angiosarcoma are the list of tumors. That's the reason it is also called acquired hypophosphatemic rickets otherwise called renal phosphate wasting. Why does it basically happen? There is an overexpression of a gene called as FGF23. FGF is fibroblast growth factor. So there are some tumors in which this fibroblast growth factor 23, which is phosphatidylcholine, it becomes overexpressed. So what are those tumors? Mesenchymal tumors of vascular origin like hemangiopericytomas, hemangiomas, giant cell tumor of the bone, non-ossifying fibromas, osteoblastoma, osteogenic sarcoma. Do you think you will remember these things? Very difficult. Don't make an attempt. But at least how many times this was asked, let us see. Whenever you see a question, doctor, try to judge whether it is a Halley's comet, like once a while, once in 100 years question, where your granddaughter will come and say, oh, during your time it was asked and during our time also it is asked. So it's a Halley question, Halley comet question. Once asked in 2006, never asked. So what does the forensic medicine say? For 7 years, if you don't listen about anybody, he is treated to be dead. So there is no point in wasting times. You can start using his toothbrush, car, everything, his home, everything, treating him as dead, right? So this is also such a Halley comet wala question. So don't worry on that. Because if you try to remember all this list of tumors, main list you will be losing. Main list is what are epiphyseal, metaphyseal, diaphyseal. Whole list to tips mein rehna. So for the want of some list, we have to sacrifice some list and pray them that I can't remember you, but you are a great big list, and then go ahead. That's how you need to go forward. So what is Maffucci syndrome? Maffucci is a combination of enchondromas with hemangiomas. So enchondromas are typically pharyngeal tumors, along with that you are finding hemangiomas. So this is a classical patient who has got multiple enchondromas like bony masses along with hemangiomas, a classical case of Maffucci syndrome. But nowadays, it being a image based exam, examiner can sometimes toil with your clinical knowledge by giving an image and say possibly this could be which of the following syndromes, Gardner syndrome, Maffucci syndrome, etc. Then at least you should remember this image. Then if the enchondroma of the Maffucci undergoes a malignant transformation, what will it lead to? It lead to development of a chondrosarcoma. Secondary chondrosarcoma is what you need to remember. So that is the story, doctor, called as bone tumor. There is a lot of many more facts on bone tumors, but at least for now. So in the online, in the anatomy2medicine.com video library, bone tumors, in the orthopedics you have got a 40-minute lecture, right? If you are not yet happy, then fully review that, but you please review that so that you are ready with all facts. Right?